Hi Josh, my name is Patsy Muncie. I'm a registered nurse and I'm going to be doing your physical examination today. It's going to take us about 45 minutes probably. If you have any questions as we go along, you stop me. We'll let you ask your questions and I'll give you an answer. And I need to ask you, do you need to go to the bathroom before we start?
I do not.
Okay, so we're just going to start at your head and work our way down. Okay?
Perfect.
So first thing, you're going to look at your hair. Brown. Look straight. I'm not going to have you take your little ponytail down there. And I'm just looking to see if there's any dryness or scaling, and there isn't. And then I'm going to be feeling your head. Let me know if you feel any tenderness. Okay, you just look up at me. Okay, and just looking at your face, everything's symmetric. I don't see any skin lesions. Your skin is evenly tanned. And I'm just going to be feeling around on your face, see if there's any tenderness anywhere. Okay, and the next thing I want you to do, we're going to check cranial nerve 7. So I want you to smile at me. Let me see your teeth. And frown. And then puff out your cheeks. And then I'm going to press on them. Okay, and the air came out evenly. Then I'm going to feel right here. You have a pulse right here. It's called the temporal pulse. And that is equal and 2 plus bilaterally. And then we'll come right down here. This is your temporomandibular joint. So I want you to just open and close your mouth. A little bit popping. Okay, now open your mouth about halfway and move your chin side to side. Oh, great. And then if you can open your mouth about halfway and push your chin forward and then pull it back in. Okay, so that's all the range of motion of your TMJ. Now I want you to clench your teeth tightly together, and I'm going to pull down on your chin, but don't let me open your mouth, okay? And that assesses the strength of your temporomandibular joint and the muscles surrounding it. That also assesses the motor function of cranial nerve 5, which is intact. And then let me ask you to close your eyes. And I'm just going to be touching your face in 3 different spots. And you've got some facial hair there. And you just tell me when you feel it touch. This is going to assess the sensory function of cranial nerve 5.
Yeah. 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 There. Yeah.
Okay, great. Okay, and just palpating over your frontal sinuses. You may feel pressure, but you shouldn't feel any pain. And over your maxillary sinuses, you may feel pressure, but you shouldn't feel any pain. Okay. And now, let's check your vision. So, I need you to, let me drop that in the corner. I need you to take this card, and you're going to stand where this piece of tape is, and I need you to cover one eye at a time and read for me the lowest line on this chart that you can clearly see.
DEFPOTEC.
Okay, great. So if you would then cover the other eye, and let's try that again, the lowest line you can clearly see.
DEFPOTEC.
Okay, and then both eyes together.
LEFODPCT.
Great. So that is 20/20 in the right eye and in the left eye, and 20/15 in both eyes together. All right, you can come back and sit back on the side of the bed for me. All right, so that checked cranial nerve 2. So now we're going to check cranial nerves 3, 4, and 6. So what I need you to do, I need you to just follow this pen light with your eyes. Don't move your head. And I'm going to move it in 6 different positions, okay? We'll start right there. Great. So that was cranial nerves 3, 4, and 6. Okay, now I'm just going to look at your eyes. They're symmetric. Eyelashes and eyebrows are intact. I'm going to be pulling in your lower eyelid. This is the conjunctiva. and it should look pink and moist. The white part of your eye is the sclera, and it looks very white. Irises are brown and flat. You just use my pen light to look from the side. It just lets me see the clearness of the cornea of your eye. That looks good on each side. Okay, so then the next thing we're going to do is check something that's called accommodation. So what I need you to do is focus on something on that cabinet. Just look at that for a moment. And that's going to allow your pupils to dilate. And then when I tell you to refocus on my pen light, I want you to refocus on the pen light, okay?
Mm-hmm.
Now look at the pen light and follow it in. Okay, so when you looked at the pen light, your pupils constricted and your eyes moved in together, which is called convergence. And that's what they're supposed to do. So that assesses accommodation. Then we are going to check the corneal light reflex. So I'm just going to shine my light toward your forehead. And what I see is a bright dot in each eye at the same place. And you're supposed to see that. And then we're going to check your pupillary response. I'm going to shine a light into this eye. And what I should see is that this pupil constricts, and then this pupil also constricts. So this would be direct pupillary constriction, and this would be concentric pupillary constriction. There's that light again. So they constrict from a 3 down to about a 2. And that's what we need to see there. All right, let's move along to your ears. So your ears are symmetrically placed on your head. You don't have one higher and one lower. And the external auditory meatus is open. In there. I'm just going to feel on your ears. The skin's intact. No sign of any sun damage. And let's break this bone back here. It's called the mastoid bone. And this little piece of tissue is called the tragus. Okay, we're going to do a little hearing test. So this little piece of tissue is called the tragus. I want you to take one finger and press in and out on it real fast. And then I'm going to come over to this ear and I'm going to whisper 3 words, and you just need to repeat them back to me. Okay?
Baseball. Football. Softball.
Okay, let's do that on the other ear. Press in and out on that piece of tissue.
Ice cream. Cookie. Cupcake.
Okay, that assesses the intactness of cranial nerve 8. Okay, and I think the last thing we're going to do on your face is look at your nose. Straight, symmetric, and you just palpate, if you feel any tenderness. Now I'm going to take my pen light. I'm going to ask you to tilt your head back just a little bit. And the nasal mucosa is pink and dry. And let's just make sure you can breathe through both sides. So take a finger, press it against your nose, breathe in and out. No obstructed breathing, and let's repeat that on the other side. Great, no obstructed breathing there. And now I believe we'll look in your mouth. How's your gag reflex?
Okay, I guess.
I just don't want to make you gag. First, just be looking. Buccal mucosa is intact. And the surface of your tongue is pink and moist with papilla present. So let me just have you raise up your tongue. Okay, great. Underneath your tongue is pink and moist and glistening blood vessels look intact. Teeth all look to be present. They're well we'll pull down your, just leave your teeth together just like you had them. And we'll pull this down, look at your gums. Your gums fit tightly around your teeth. I'm going to look up here. Fit tightly around your teeth. Your lips are pink and moist with no cracking. Alright, now let me have you open your mouth again. This is the part that might make you gag. Stick out your tongue. Uvula is pink and moist, and tonsils look to be maybe a 1+. And while I do that again, I want you to say ah. Okay, uvula rises in the midline, which we expect to see. And if I could have you to swallow, which you just did, swallow again. Your trachea moves when you swallow, so that assesses cranial nerves 9 and 10. And then, let me look at the roof of your mouth, make sure that's intact. That looks good. Everything's intact there. And then I just need you to let me touch inside your mouth. I'm going to slide under your tongue. Just palpate there. Feel any lesions there, and then I'm going to palpate the roof of your mouth. And I don't feel any lesions there. So the last thing I need you to do is stick out your tongue, move it to the right side and to the left side, just right, left, and that assesses cranial nerve 12. I think that's all we have there. Okay, let me check some lymph nodes. All right, you have lots of lymph nodes in your face. So I'm going to start right here. What's in front of your ear are called pre-auricular. And then you have some behind your ear that are called posterior auricular. And the expected binding is I don't feel any. You have one right here under your ear that's called the jugulo-digastric. And then coming around under your jaw, these are submandibular. There's one right behind your chin that's called submental. And then right along your hairline, these are called the occipital lymph nodes. Feel any of those. If you just turn your neck just and tilt your chin down just a little, you feel down your neck. It's called cervical. And there, and if you reverse that on the other side. Okay, and if you would just hunch up your shoulders, I'm going to feel right here along your collarbone. It's called supraclavicular. I don't feel any lymph nodes anywhere there. Okay, so while we're there, let's go ahead and check range of motion of your neck. So first I'm just looking at the skin. Male pattern facial hair. It's been shaven down on the neck, but there's no skin lesions. Skin is warm when I touch it. And I'm going to have you pull your chin down toward your chest. And then I want you to tilt each ear toward a shoulder, close as you can get. Then back the other way. And then tilt your head back. Okay, and then look to your right and look to your left. Okay, now what I need you to do is push against my hand. Just turn your head toward it. Thank you. And push forward. And push back. So that assesses the strength of the muscles of your neck, and that also assesses cranial nerve 11. The last thing we're going to do to assess cranial nerve 11 is I need you to push up against my hands with your shoulders.